While illness and disease are terms commonly used to describe the biomedical and individual experience of poor health, sickness, or the lived experience of disease, is imperative to describing the underpinning social and cultural factors. Two sociological approaches have attempted to address the social aspect of sickness: the sick role by Talcott Parsons and the ecological research conducted by the Chicago School.
Parsons was a structural functionalist during the mid-1900s, stating that sickness is a deviation from the social norm. As illustrated in Illness and the Role of the Physician, a sociological perspective, sick individuals have four key rights and responsibilities. Firstly, the individual is temporarily exempt from normal responsibilities. While the individual is not responsible for their condition, they are expected to get better by seeking the appropriate treatment. For example, an individual suffering from a cold is exempt from some social activities, but is also expected to get better by keeping warm, resting, and drinking lots of fluids. The sick role is appropriate for creating a generalised definition of how sickness affects individuals in a social context. However, the concept remains heavily flawed.
The sick role has negative impacts upon an individual and their social relations, especially in chronic and unobservable illness. For example, a study by Claire Glenton shows that chronic back pain sufferers struggle to achieve sick role status and strive for their suffering to be validated to reduce social stigma. As a sick role is based off recovering in a timely manner, it is inadequate for describing cases of chronic illness. Subsequently, the inability to fit within the sick role results in stigmatization, as apparent in a study by Matthias Zickerer-Ruhl, who notes that individuals juggle expectations of the sick role and their normal roles. He argued, and I quote, "Balances must continually be struck between doing too little and doing too much. If sufferers ignore symptoms and press on as normal, they risk being perceived as reckless. If they take great care of themselves, they run the risk of being seen as invalids or malingerers."
The major flaw in the sick role is Parsons' armchair approach. Simply thinking and conceptualising sickness in society is not representative of what often occurs. Parsons didn't consider the social conditions and situations that may prevent individuals from recovering. The Chicago School of Sociology had a different approach, using a synthesis of ecological and epidemiological research when applied to public health.
One important distinction is that the Chicago School was concerned with mapping the prevalence of certain illnesses at a macro level, while Parsons' sick role is concerned with understanding how illness is individualistically treated at a micro level. For example, when sociologists from the Chicago School were collecting data on rates of schizophrenia in urban areas, the sick role would assume that the individual would seek immediate treatment to recover in a timely fashion. Unfortunately, this generalized approach does not account for the nature of the disease, race, and social class. In relation to our schizophrenia example, the condition was more prevalent in poorer areas, with the type of symptoms dependent on this community: catatonic in Afro-American, migrant, and poverty areas, paranoia state in isolated areas.
The primary difference between these two concepts is that Parsons' sick role is a highly conceptual understanding of sickness, which does not always reflect reality. This, in turn, may prevent someone from recovering from their illness. The Chicago School of Sociology, in comparison, measured individuals qualitatively to find the relationship with social relations, geographical location, and mental illness. More empirical research should be conducted into how the tension between failed sick role and social factors influence the stigmatization of key mental and chronic illnesses.